In this lecture, we will discuss left arm, right arm lead reversal and how to identify it on the EKG. Making sure that the EKG leads are connected to the correct electrode position is important for getting accurate rhythm strips in 12-lead EKGs. If the leads are reversed, we call this lead reversal and can often produce EKG abnormalities. It is important to be aware of accidental misplacement of the limb lead electrodes because they may mimic various pathology, including chamber enlargement, ectopic atrial rhythms, or even myocardial ischemia and infarction. Now, when the limb electrodes, that is the left arm, the right arm, and the left leg, are exchanged without disrupting the neutral electrode, which is the right leg, then Einthoven's triangle is flipped 180 degrees or rotated, resulting in leads that are switched in position. They become inverted or remain unchanged, depending on their initial position and the vector. As we continue to go through different forms of lead reversals, the goal is to be able to see why these EKG changes occur and then be able to reason them out on your own instead of memorizing anything. We'll also mention a few things to look out for in each case in order to spot them quickly. Here we'll be looking at the left arm and right arm electrodes and when they're reversed and what we can see. In other words, there is a 180 degrees rotation around the AVF axis here, okay? So this is left arm, right arm, reversal, okay? If you recall from our Einthoven's triangle, here's our right arm, here's our left arm, okay? And what we're doing now is pretty much just reversing them around our AVF. So AVF is pretty much our central point. Imagine this here, okay? And we're going to switch all of these, okay? So now the left arm comes here, the right arm is here, AVF is still our central point, okay? And we'll see what happens in this case. Now, because we're rotating around AVF as the focal point, AVF will remain unchanged. With all the other limbs, they will either become inverted or switch places. In this case, lead 1 will become inverted, leads 2 and 3 will switch places, and so will leads AVL and AVR. Okay, so again, we're switching right arm and the left arm. So we said this is our left arm here, right arm here. AVF will remain unchanged, okay? And then because of that, so here are our limb leads. So this is normal, and this is what happens in this left arm, right arm reversal. So AVF is right here. Notice that it's unchanged. Next, we said that lead 1 will become inverted, and that should make sense. You're pretty much switching places. So 1 is still here, but now will be the negative portion of it because the right and left arm have switched place. So here's lead 1. Notice how it's now inverted, okay? And we also mentioned that leads 2 and 3 will switch places. So here's lead 2 and lead 3. You can see lead 3 is now here and lead 2 is here, okay? So here is lead 2, okay? And this is lead 3. Notice that lead 2, which was this one here, now switches places with this. So now we have lead 3 here and lead 2 there, okay? And then we also mentioned that AVL and AVR switch places. So here's AVR, AVL, and because they're rotating around that axis, now AVL will come here and AVR in this place, okay? So notice here's AVR and AVL, and these will also switch places, okay? So now we have AVL in this point and then AVR here. So everything in red are the changes that you actually see going on, okay? So one thing to keep in mind is if you see an inverted lead 1, right, because it switched places, so everything's now inverted, including the P waves and or the QRS complexes, you should consider this left arm, right arm reversal, okay? So this is one of the key ones I want you to take away. So just a few other clues. If AVR is positive, it may also be a clue. And this is because oftentimes AVR is negative, but switching places with AVL may make it positive. It's not the case in this example, but that's something you can keep in mind. In addition, you may see marked right axis deviation. You can see that here, lead 1 is now inverted and negative, while AVR is unchanged and positive, okay? So notice if we look at our axis, here's lead 1, here's lead AVF. Remember, our normal axis lies between 0 degrees and positive 90, or at least negative 30 in this region here, okay? So negative 30 to positive 105. And because it's positive and upright, okay, in this lead, we'll be heading in this direction, okay? And then in AVF, it's also positive. So we have an axis somewhere in this region. Now, when we have the limb lead reversal, this left arm, right arm, if we look at our axis here, okay, here's lead 1, here's lead AVF. What do we have going on? Well, lead 1 is now inverted, okay, so mostly negative, going away from it, and lead AVF is unchanged, so head in this direction. So now our axis lies somewhere in here, okay? So while this was like normal axis, this would be right axis deviation, okay, and that's this quadrant here. This would be their left axis deviation. This would be extreme, okay? So that's where you can see that marked right axis deviation. Now, one last thing to keep in mind with this left arm, right arm reversal is that it may mimic dextrocardia, a congenital abnormality in which the heart points to the right side of the chest instead of the left side. What helps to point you towards the left arm, right arm reversal is the normal R wave progression in the precordial leads. With dextrocardia, the precordial leads would also be affected. Hopefully that makes sense. All right, let's review what we discussed before we end. So left arm, right arm reversal is 180 degrees horizontal rotation around AVF. Okay, so here's AVF, and all we said is they're switching places. So if you're able to draw out this Einthoven's triangle, you can see that AVF is unchanged. Lead 1 becomes inverted. Okay, the ones that switch places are 2 and 3, as well as leads AVL and AVR. Other clues where AVR is often positive, not in this case, but that's one thing to note because it's switching places with AVL. Okay, you can also see marked right axis deviation, and remember it may mimic dextrocardia, except in this left arm right arm reversal we have normal R wave progression in those precordial leads. Well, that's the end of this lecture. We discussed left arm right arm lead reversal and how to identify it on the EKG. I hope you learned something.